Hello, today is August 2nd of 2022, and I'm here with Peter. And Peter, I'm actually going to have you please introduce yourself and tell us a little bit about what your job is.
Thank you so much, Emily. And good morning, good evening, good afternoon, everyone, wherever you are. My name is Peter Ahabwe Babigumira, and I live and work in Uganda, Kampala, the capital city. I work with the Infectious Diseases Institute at Makerere University, which is Africa's oldest and most prestigious university. But I am seconded to Ministry of Health since March of 2020, that's formally, to support the COVID-19 response and other public health activities. Part of my portfolio from further back over the last 6 years has been the broader health security. So I have expertise and experience in antimicrobial resistance, biosafety, biosecurity, IHR implementation, linking public health and law enforcement. And at some point, we also did some further specialization in pandemic preparedness.
Wonderful. Well, thank you so much for being here with us today, Peter. And now, kind of looking back to December of 2019, could you tell us what you were doing then, and then maybe a little bit about how your work shifted given the spread of COVID-19 in the spring of 2020?
Thank you so much. So, as I mentioned before, Uganda has a health security kind of program and has been part of the global health security agenda since 2014 as a founding member. So in December of 2019, Uganda had taken over from the United Kingdom as chair of the action package of AMR, and as part of the secretariat, I had traveled to Geneva for the Biological Weapons Convention, but I also took the time to meet with the folks at WHO's AMR unit just to touch base and synchronize on our activities. So pretty much at that point, then the following year was looking like the usual workshops, seminars, meetings, because policy work is a lot. It's a people business. It's not sitting in a hospital. My background is the pharmacy. It's not sitting in a hospital and giving out pills and going home at the end of the day. It's a lot of relationship building and working with people. And still building on that, from the December of 2018, Uganda was invited to Hong Kong. WHO had convened a global technical meeting on pandemic influenza preparedness. And as part of the delegation there, we approached WHO to add us to a pilot they were doing, where they were doing a crosswalk of national plans, national action plans for health security, and using them to build on pandemic preparedness. So over the following year in 2019, we were able to do 2 workshops to develop our preparedness and response plan for pandemic influenza and also our national vaccine deployment plan. So another outlook for 2020, at that point, we were supposed to have workshops and simulation tabletop exercises with the Geneva team to further refine our vaccine deployment plan. And we're also supposed to have internal meetings to build consensus on the drafts of the pandemic influenza plan and get them approved, because we were expecting that we would have a pandemic at that point. So pretty much for the subsequent year, it was AMR and pandemic influenza at that point.
Wonderful. Well, it is so amazing to hear about all your work and preparedness work and everything that you were engaged with. And then, how have you further been working throughout this pandemic? And what are some of the things you have been doing now since the spread of COVID-19?
Thank you, Emily. So, as I mentioned, at the Ministry of Health, there's an event-based surveillance unit, and one of the key tools that we use, the usual ProMed and Gfin and all that, but we're also using TweetDeck, which is kind of an aggregator for Twitter, just helps you organize your tweets and everything. So the first day back from the holiday leave, the first thing we noticed was all these reports coming out of China about the strange new disease. And because we're on high alert for pandemics, and I was the pandemic influencer guy, I kind of pushed everyone and I told them, this is it, it's here, it's here, it's here. So eventually I had some of my supporters and they said, okay, let's raise this to the National Task Force. And I really am thankful that people really, at least the credibility had built up to that point and people are willing to take it seriously. When we presented it to the National Task Force, they decided that it was something worth doing preparedness for. So as early as January, we had started doing assessments to look at our case management capacity based on what we were seeing in other countries where the gaps were. We were assessing our own gaps. We checked out our airport. We started planning for things like non-traditional isolation facilities, quarantine. So as of Thursday, 25th, I think it was, of December, the National Task Force actually created a provisional incident management team to begin to really take lead on that work. And surprisingly, by Friday, a public health emergency of international concern was declared. So Saturday morning, it's like COVID-19, talk to me. And by then it was called NCOV, 2019 NCOV, and all the other slew of names. So the Prime Minister called the minister convened the team. So we headed into office on Saturday. We had to prepare for just putting together what we had been doing, our work, as well as doing cabinet memos and general information for health facilities, what they should do to prepare, since by then it had been declared a public health emergency of international concern. We met the Prime Minister, we met the Minister first in the evening, then the Prime Minister after. And on Tuesday, the following week, we went to State House to meet the President. It was a mixed delegation of Ministry of Health and the CDC, WHO also, to see that the national leadership got an appreciation as early Feb of what the situation was. So preparedness activities ramped up all through Feb. We got our first, it was very intensive, it was very confusing, and Uganda was one of the first countries to preemptively put a halt on travel, and many of our institutions followed suit. Funny thing is, I had like 4 travels, in the month of March, from Vienna to Washington, DC to Nairobi. It was crazy, but everything, was just shut down. And we started working 24 hours a day. We had a situation room, like our command center, but it was activated 24 hours. So I was happy to be part of setting that up. It was nice that all this preparedness work we had been doing really came through. So we set up our command center, we set up the night shifts, we started doing I think they're called the case lists, right? For linking the lab results to the EP teams to follow up. Then later on, we even started doing the ambulance evacuations for the confirmed cases. At some point, as you know, Uganda is a landlocked country, and we still continue to have a lot of truck drivers moving through the country. So they became a main source of because there was no international travel. They became a main source of concern. Truck drivers, it's another thing that came onto our portfolio, trying to link the truck drivers to health services. So, it got really intense. You were pushing the 24/7 days a week, and there were a lot of activities, case finding, case management. We moved to quarantine. So we had district level quarantines. And at some point, much later, we even now moved to home-based care to try and decongest health facilities. So we pushed through with this until October 2020, when I had my second born child. I took annual leave. I took all my missed weekends, and paternity leave, and I just took like 3 months of the response. And yeah, everything else, COVID kind of just became usual business after that. Over.
Wow, well, it is amazing to hear you speak about how engaged you have been and kind of for us to understand all the step-by-step actions that had to be completed once COVID-19 began to spread. And you kind of mentioning the situational room is really interesting. So thank you so much for sharing about that. And your work has been tremendously important. And then kind of looking forward, could you describe a little bit about what comes next for you and what the next 6 months may look like?
Yeah, thank you. So, first of all, on the personal level, so I had a lot of time to reflect during the COVID-19 pandemic, especially when I dropped off for a bit in October of 20 till like around March of 20, like Feb of 21. So I did a lot of personal reflection, looking at our country response and where the lags were and where the gaps were. I really asked myself, so where did we miss the ball? How could we have done this better? And most importantly, what academic pursuit do I need to build skills to take this to the next level? So this really, in my introspection, I realized that health security at this stage is largely a problem of international relations and international security. A lot of us folks in the health sector think health is still our thing. We think health is all about doctors, nurses, and pharmacists running around wards and then getting jobs in ministries and doing policy. But it has changed a lot. And we need experience from folks in diplomacy, foreign affairs, international relations, international security, negotiators. So this influenced me on the personal level to start a master's in security studies. And I hope it will really build a strong academic foundation such that the next time I'm really called on as an advisor or as a team member, my inputs can be better informed. Then on the professional level, it just happens that, at the time of this interview, I was co-opted into the our leadership invited the COVID-19 incident commander to take charge of the MABA, of the monkeypox preparedness and response activities. And as part of his team, I was also co-opted into the monkeypox team. So I think for the next 6 months, it's really going to be monkeypox for me. My core portfolio, like I said, since COVID really kind of normalized a bit for us, I've been focusing a lot on border health, and so it would, and biosecurity. So it's really going to be monkeypox, biosecurity, and border health for me for the next 6 months as I navigate my Masters of Security Studies on weekends. I'm also going to take a course in policy advocacy in global health. For me, studying is a tool to improve how I work. So I do a lot of short courses and ranging from different topics. Today it's international relations. Tomorrow it's something else. But really, I ask myself this fundamental question: how could we have to pick up to build it? Over.